Now, we all know the NHS has hit a bleak new milestone. This is terrible. A record 7.6 million people are now on waiting lists, with 380,000 of us waiting over a year for treatment. Now, in an attempt to curb this backlog, patients who have the ability to travel will be allowed to bypass queues in their area by being treated at hospitals further afield. What if those have queues? Anyway, in a bid in the books of under 65s, right, won't be eligible for a COVID or flu jab this winter. Apparently that's important. Those deemed vulnerable will. To anybody with a brain cell, it's obvious the NHS is in crisis. And my question tonight is, and I'm really interested to do this, because is part or full privatisation the only way to deliver a better care for us, the taxpayers? It really is important to me. We pay the taxes. What are we getting? In to discuss this, Dr. Sharon Raymond, NHS GP and the Director of the Crisis Rescue Foundation, and Dr. Aaron Ghosh, private GP and Director of Ghosh, or even Ghosh Medical Group. Thank you both very much indeed. Can I start with you, if I can, Sharon? This allowing patients to skip the queue, just if we could touch upon that to begin with. How do people find out if another area is in a better position than their area? I'm slightly confused.
I mean, there has been... nice to see you, by the way. Thank you for having me.
Pleasure.
There has been choice in the NHS for some time. And I think, you know, on the whole, this is a sensible idea to take some of the pressure off where systems are perhaps coping less well than in other areas. So to me, it certainly makes sense. And of course, it depends, you know, how that is managed in an equitable and organised manner. So it will depend on the pressures in different areas, and there will be, I assume, you know, a system to identify where there's greater availability. And if people can get to those appointments and procedures, surely that's going to reduce some of the pressures in areas where pressures are higher on the NHS. It will release some of that capacity that's so stretched right now.
What do you make of a system that I know you support, you work in it, that milestone? I mean, 7.6 million people waiting to get an appointment, 385,000 waiting for treatment. I know you believe in the NHS, many of us do, but it doesn't work, does it? Not anymore.
I think we have to be realistic. You know, the ethos on which the NHS is based are entirely admirable and equitable. There are stresses and strains more than usual now as we're, you know, getting used to this post-pandemic times that we are in. And therefore, you know, it will take time to get back to normal. And that has to be, you know, appreciated and accounted for. And I think, you know, I guess the government is looking at ways to address some of those pressures and is working on that. I'm by no means here to, you know, to represent any political party, but I think, you know, we just have to look at things in a very sort of neutral way and try and understand the pressures and appreciate that you know, we did go through a pandemic. It was very hard.
I have to say, Sharon, I have to say that I agree with you entirely. I think it's about time that we put politics aside and looked at something. I like your word ethos. It was a great invention. It doesn't work, and we know why. Bringing Aaron in, I mean, we know, don't we, Aaron? You know, it's a larger population. It's an ageing population, and the NHS in 2023 is not what it was supposed to be. It's fair to say your story, NHS GP, didn't feel you were able to do it, went private. Now, the NHS is already spending money in the private sector. Why don't we just come out and do that and make it more efficient? What's your view?
I think without the private sector, and we take political parties on board, it was actually the previous Labour government that opened up the private sector into the NHS to allow these contracts. And it's been continued by subsequent governments since. It's going to be vital. It's going to be absolutely necessary for the private sector to step in now and help the NHS. And if we don't accept that, and if we don't see that as an option, we are doomed.
How do you believe you would be criticised by some for going private? It would be, if you like, you know, throwing in the towel. And let's go back, opinion from you about looking in other areas. We talked to Sharon about it. Presumably with the cost of petrol and the cost of living crisis, a certain sector wouldn't be able to even afford to travel to go to a doctor 70, 80, 90, 100 miles away. So are we then back to a system which is the less well-off are again going to be at the back of the queue?
Well, that's actually not true. And I agree that it would be the fundamental worry that those who were poorer didn't have the income. When they did a one-poll survey on this in 2022, so just coming out the back of the pandemic, those with an income between 10,000 and 30,000, up to 81% were quite happy to travel up to 100 miles, would you believe, to get NHS treatment, because they are aware that that treatment is so fundamentally necessary to the well-being. Of course, cost of living has gone up even since then, so I'm not sure whether this year that will be the exact same post, but it just shows you the willingness of the public, because they are aware the NHS is in crisis. They are fully aware now that they may be waiting months, but the difference between going between simply 5 and 10 miles can actually be a waiting drop between 6 months. So that's a huge amount of wait. Now, if you're in pain or if you're in agony or you can't work because of this operation that you need or this treatment, you are more than willing to go and do that.
I completely agree. Sharon, wanted to ask you one thing before we move to the panel. Part privatisation, we talked that the NHS is already spending money. When you look at the model, and Aaron, I think, is spot on, people are getting desperate. For those who can't afford it, do you not think we should perhaps look at a different model for a generation that I think it's... I love the concept, I just don't think it works. And all the people who work in it go, oh, you can't say that. Well, you can, it doesn't work. 7.6 million people waiting for an appointment is appalling.
Jeremy, the reality is that, the NHS has been accessing private providers for some time now. And I think, as I say, we have to look at all sorts of strategies to make things work. And also, if people who are able to are travelling further afield to get their care, and, I emphasise if they're able to, then it means that those who are less able to have less, perhaps financial resources or ability, to leave their area to get care. They may have, a shorter wait in order to get the care in their area. And I think we need to be mindful of that and think about ways to free up capacity, where things are particularly, in areas where things are particularly stretched, where the NHS is most stretched. So I think it does make sense.
Sharon and Aaron, it sounds like a pop group. I'm very grateful. Thank you both very much indeed for coming on. A private GP, an NHS GP. Nick and Rebecca still here. Nick, can I start with you? NHS 2.0, time for a change, isn't it?
It's definitely time to change the model. In answer to your question, I think we should look abroad to Europe. Holland has a brilliant model. It is a combination of a social insurance, employer insurance. There's no two-tier system. It has some of the highest access rates and very few waiting lists. So we can learn from abroad. We don't have to go to the extremes. The political problem is the left and the right, Conservative and Labour. I agree, they should come together. I would be all for that if they could really rationalise this problem. But it's such a divide. It's going to be another football come this election, and we'll probably end up with things worse off. On private sector, listen, people out there generally don't care where the provision of care comes from. If it's private sector or not, as long as it's free at the point of delivery, for the vast majority of them, let's use the private sector to help people get better.
Bex, can I ask you a question? If you're on a waiting list for a year and you could afford it, would you go private?
Yeah, and I think that's isn't that a sad reality that would even be a situation people are in? And the saddest thing is that, maybe for people like us, the option to go private doesn't feel completely inaccessible. But for the majority of people in this country, the choice of kind of paying for your healthcare or not is not something that they have available. And so the idea of kind of introducing even more sort of private sector partners into it, I find quite scary.
But is there
a gateway to sort of American healthcare?
I know, but is there not a point that, and I'm not trying to suggest means testing, and maybe I'm missing the point, but is it fair to say that if in this country people who could afford it put their hands in their pockets, that would open the remainder of the NHS to the very people who are missing out? And we talk about immigration, I love the concept. I think it was the greatest invention in the modern world. It doesn't damn well work.
It absolutely does work, and I think if we did something that you're suggesting, you do then get this two-tier healthcare, don't you? So if you can afford to pay, you're seen, you get next-day doctors, you get your prescriptions, you get your operations, you have a healthy life. If you are someone that's relying on state-provided healthcare, which then doesn't have as much tax in it because of the fact that people are now able to go private, we do have a two-tier health system, and we end up having the poorest and the people who need the most support at the back of the queue.
For me, it's about how we get those queues down, Nick,
it's the model, because Becca threw in there, she said, if we have more private sector health in the NHS, we'll end up like America. Forget America. No one wants to be like America. It has some of the worst outcomes in the world. the place to look, as I say, is somewhere like Holland. There is no two-tier system. You have social insurance covered by the state.
So why doesn't your government implement that policy
Listen, absolutely.
then? Why haven't they looked abroad?
I've had MP after MP on the show from left and right on my show, and guess what they say? They say the NHS is the envy of the world. It's wonderful, and they won't even consider new models that will not
because
need.
it is. Because
Is it fair?
Because it is the envy. Because it is the envy of the world. It's also a national religion.
The idea.
Absolutely. So why would we abandon the idea? It doesn't. It works in practice, but you need to fund it. You can't.
Are we missing a word here? Adaptation, aren't we? Shouldn't we be adapting it to a different?
You're not abandoning it.
We already have private. There is already.
But is your answer not exactly what he's saying? That people are so set up with it's the envy of the world, it's amazing, we don't criticise it, we don't change it. It needs adapting, doesn't it?
If it's the envy of the world, you need to pay for the envy of the world. And chipping away at spending on the NHS over the last 13 years, like this Conservative government has done, does not keep it as the envy of the world. And blaming doctors and nurses for a system that doesn't work,
but it gets, unless I'm wrong, more money than it's ever got. Nick Dubois, let me ask you this. Is it about pouring more money? Is it about efficiency? Is it about what is it?
Well, I think you have to look at what are we spending compared to other countries. You can draw that comparison. And actually, in GDP terms, we're not far apart from many of our European competitors. But it's how that money is spent. And also, look at something really important, and I get sick to death, this is never done. And I do have a pop at the left generally, not you, of course, Becca, about this. Because what is not being talked about is, if we are the envy of the world, why do we have some of the worst outcomes? The British and Commonwealth medical survey that's done every few years are the top 10 comparative economies. We're second from bottom. That's not the envy of the world. That's the shame of the world for what we're doing. So change the model. It doesn't mean...
Change the narrative,
doesn't mean you change free at the point of delivery access when you need it. That's the point. And no one's grasping it, and politicians least of all.